Hi, my name's Nigel Carver. I'm a consultant plastic surgeon at One Hatfield Hospital. I've been a consultant for 20 years. I was previously at St Bart's Hospital in the City of London. And one of the procedures I do is eyelid reduction surgery, or blepharoplasty. This is probably one of the first procedures to think about if you want to reverse the effects of aging, because the first thing people look at is your eyes. People are troubled by hoods like this, I don't know who's going to do mine, and bags underneath, so they make you look older, unapproachable, tired. So when people come to see me, the first thing I've got to do is I've got to check medical questions about eyesight and any problems in that regard. Once we're through that, obviously I will be looking at the amount of skin that can be removed from a hood if that's the problem, and if there's excess fat in the lower eyelid. In concept, the procedure is relatively simple. It happens under a full anaesthetic and it can be done as a day case. When someone's asleep, I mark out the area that I can take away. After that's taken away, there is actually a stitch line which is in the crease from the inner corner to the outer corner, and then it actually turns up slightly as a more attractive line, and there's a stitch that stays there for 1 week. Now the procedure for the lower eyelid is completely different. What I actually do is I bring the eyelid forwards and the incision line is inside, and so there's no scar. That means that the recovery is quick, easy, and with no signs of surgery. It works exceedingly well, and people are very happy with the outcomes. Now, in the recovery, the downtime is approximately 2 weeks. There will be some swelling, there will be some bruising, and you have to take time out to rest, because as you can appreciate, the more movement there is, the slower the recovery. When you wake up from surgery, you're propped up in bed, and there is some anti-inflammatory ointment, and literally type of wet flannel across the eyes with just cold water or saline. The important thing is to rest as still as possible, as much as you are able. Get all the domestic tasks taken care of so you can just chill out for a couple of weeks. The stitch in the upper eyelid would come out at 1 week, and then there's a follow-up appointment at 2 months, and that's an opportunity to review the before and after photographs and what the outcome to be expected. And as I say, results are usually excellent and quite a dramatic change. And it's very interesting though that people's friends will actually say, there's something different, but they don't quite know what it is, because if it's done carefully, you can't tell. So if you're interested in considering that sort of procedure, please do call the hospital. I'll be delighted to see you. They'll make an appointment to see me or pass my secretary's details to you so that we can make contact. And I'll go through it thoroughly, and I'll illustrate the appearance that you want to change with photographs of previous patients who've given their permission for their images to be shown, so that you can really see what's going to be achieved and whether it's worthwhile for you.